time we move on to a new zone. We move on to the scapular region. This particular zone is termed as the scapular region grossly. Now, what important features have it us over here? Let's have a look. So we are having a posterior view of the right sided scapula. That is the lateral border hidden by the original muscles, namely the teres minor, teres major. And over here you can see a glimpse of the deltoid covering the shoulder joint, forming the convex contour of the shoulder. Now that's the long head of triceps brachii muscle. Clear? And that's the shaft of the humerus. Now, spaces we talk about over here, quadrangular and triangular. Firstly, we'll talk about the quadrangular space that will have the following boundaries. That is a quadrangular space. It's bounded above, you can see, by teres minor muscle, but that is the posterior most muscle. If we discuss the boundaries from before backwards, not seen over here, most anteriorly we'll come across subscapularis, then a part of the capsule of shoulder joint, then teres minor. So three structures from before backwards: subscapularis, lower part of capsule of shoulder joint, then the teres minor muscle. These three form the boundary above. The boundary of the quadrangular space on the medial side is served by the long head of triceps muscle. This portion is the boundary. The boundary below is the handiwork of the teres major muscle, as you can see. That was the boundary above. And the boundary on the lateral side is coming from the surgical neck of the humerus. That's the four boundaries of the quadrangular space. You can see a couple of structures traversing the space. What structures? Very important structures: a nerve and a vessel. What nerve? That is the axillary nerve over here. The two divisions, that's the anterior division and that's the posterior division. So the nerve is axillary nerve and the vessel is the posterior circumflex humeral vessels. So the axillary nerve and the posterior circumflex humeral vessels traverse this quadrangular space, the contents. Thank you. Now we come to the zone over here. That is a triangular shaped zone known as the triangular space, bounded laterally by this part of the long head of triceps brachii, bounded inferiorly by teres major, bounded superiorly by teres minor, and the apex of the triangle is along the lateral border of the scapula, where the two muscles, the two teres muscles, minor and major, converge. And this space is traversed by a couple of, not a couple, but a structure only over here. Which structure is this? The circumflex scapular vessels and the accompanying vein. This artery is a branch of the subscapular artery, if you recall. Subscapular artery gives us this branch, and subscapular artery is a branch of the one of the three branches of the third part of axillary artery, if you recall. Right? Now, bang opposite the triangular space, we get a lower triangular space that is bounded above by a part of teres major, bounded medially by the long head of triceps, and bounded laterally by the shaft of the humerus. And this lower triangular space is traversed by the structures that will eventually reach the spiral groove of humerus. Which structures? Very well known structures: radial nerve and the profunda brachii vessels. So these couple of structures traverse the lower triangular space, right? So you can easily build up the triangular and the quadrangular spaces with your fingers like this. That's a quadrangular space. Triangular, triceps. As is mentioned over here, that's the depiction of the lower triangular space. That's triangular, that's lower triangular, that's a quadrangular space on the right hand side, right? Now, I have written it down for you. Just take a note, a recap sort of boundaries, as I told, is shown over here. of the quadrangular space. Right? Now, contents, what did we discuss? Axillary nerve and posterior circumflex femoral vessels. Fine. The triangular space boundaries as follows: above teres minor, below teres major, laterally the longer triceps brachii, apex lateral border of scapula where the minor and major muscles converge. Right? And the structure passing was circumflex scapular vessels. Come to the lower triangular space once again. Boundaries above teres major, medially longer triceps brachii, laterally shafter femoris. What of the structure passing over here? That pair of radial nerve and the profunda brachii vessels. Right? Let's come to a question. Which of the following nerves traverse the quadrangular space? Median, ulnar, radial, axillary? Axillary, if you recall. Because radial nerve was traversing the lower triangular space. Median ulnar doesn't come over here by any chance. So we rule those two out. Of the two, radial nerve is supposed to traverse the lower triangular space. So it's ruled out over here. The choices remains axillary nerve, if you recall, along with the posterior circumflex femoral vessels traverses the quadrangular space. Right? To sum up, as I told you, three zones over here: scapular region, quadrangular, triangular, and lower triangular. The structures passing once again have been given up over here, so that you recall it well. These are very important. There is saying now, the more you practice, it's better for you. So that's the thing. Yeah, so triangular face contains, lower triangular face contains all these are very important for you.